Hello, my name is Anna Majewska and I'm an international RETIX.C trainer. Today I would like to introduce you our bestseller therapy, which is called RETIBOOSTER. This is a therapy that we are using to many different problems, curing many different problems of the skin. And it contains two steps. It is antioxidant and retinoid therapy. We have amazing results. We can adjust different types of protocols depending what kind of needs do we have. And we are going to fight with many different blemishes that we are working with in the clinic nowadays. Okay, the most important thing that I would like to tell you about RETIX.C, what we are working with normally when we are delivering any therapy, any professional therapy, is the fact that we want to always work to achieve maximum effect, but with minimum irritation potential. This is very, very important for us because we know that the most important thing right now is the problem of inflammaging. So the process that is going to speed up the risk of aging of the skin because of oxidant stress, because of free radicals. So we are trying to combine the active ingredients in our product in RETIBOOSTER to get the best results, but not to speed up the risk of inflammaging because of the irritation potential. So we know that we are going to see the visible improvement on the skin. We have a lot of photos before and after. We are always trying to be sure that our procedures are working. So we are making a lot of trials, a lot of studies, external, internal studies, and also clinical case studies. For RETIBOOSTER, we have 2 clinical case studies until now. The RETIX.C brand is the all year round offer. We can decide what kind of treatment are we going to use depending what time of the year it is. And also we are going to use RETIBOOSTER or other treatment depending which country do we represent. If it's really sun exposed and we have a lot of sun exposure during the year, so we have a lot of treatments depending on the country that we are working with. Then what is very important in our brand, we are an expert in antioxidant and retinol therapies. So we have tested products in a long term of time and we know how are they working. More topical usage or using microneedling with our treatments. So it is also something very, very interesting and important for us. We have very, very unique combination of active ingredients in RETIBOOSTER. It is not only retinol, but we are combining retinol with TGF-beta growth factor. It is plant origin growth factor. And with this growth factor, we are going to increase the efficacy of retinol, but we are decreasing the risk of inflammation. TGF-beta is going to protect lipids in epidermis, so it's going to make the risk of dryness of the skin much, much lower. And also, it is going to make the risk of irritation much, much lower. And also, we have very important, also what is important, we have very interesting therapies and home care products to achieve the antioxidant action with the AUX Cell Protect Complex. With 7 antioxidants, they are going to work amazing to get this great anti-inflammatory and antioxidant action. Our protocols, our therapies are always personalized. It means that we do not have a lot of treatments. We do not want to get like 20, 30 treatments and thinking that we have like each one is a little bit different, but not much different. We are delivering smart boxes with the treatments, and then each professional treatment is coming with different types of protocols. So depending on the skin of the patient and the patient needs, we are going to adjust the protocol. So in that case, we are able to recommend the RETIBOOSTER treatment to normal skin, mixed skin, oily, acne, hyperpigmentation, but also we can recommend this product to dry skins, to sensitive skins, to vascular skins, and we're going to decide which type of the protocol are we going to perform depending on the skin type that we're going to work with. Also, what we want to recommend to our specialists is to combine, to link professional treatments with home care products. So we're always giving the recommendation how to work with that, how to sell the home care products with the professional treatments to the final customer, to the patient, why this home care product is going to be the best to prepare the skin for the professional treatment, and why this like other product is going to be perfect to prolong the effect, to maintain the effect of professional treatment that we are working with. RETIBOOSTER is our, as I said before, it is our bestseller therapy. It is patent pending right now. And the two steps of the procedure that we have in the box for the professionalists is the anti-oxidant ampule. And this is the first step. The ampule, what is very important, the ampule is sterile. So it means that I can use it or topical, or I can use it performing microneedling. And in that case, I am going to perform the microneedling with the ampule of the first step of the procedure. Then the second step of the procedure is the vial with retinoids, and here we have 6% of retiboosting complex. This is 4% of pure retinol and 2% of TGF-beta growth factor. As I mentioned before, the growth factor that has the same metabolic pathway as retinol, so it is going to work as retinoids, but it is also going to make the irritation lower because it's going to protect lipids in epidermis and slow down the risk of irritation. On the right side of the box, we have a tube with the home care cream and 5 small empty jars. After each single procedure, I am going to fill the jar with the cream, and the patient is getting the sample for the home care usage. This is the Ultra Repair Moisturizer cream, which is going to work to calm down the skin because we have ecto in there, and also to achieve the moisturizing effect. RETIBOOSTER is the multi-directional therapy that we can work with using this treatment for anti-aging patients, for melasma patients, for acne patients, for post-inflammatory hyperpigmentation, post-acne scars. So it is amazing therapy to use in many, many different directions. Why we decided to use 6% of retinol in our product. This is also very, very important, and to get this knowledge, we are going to know more about retinoids. The retinoids are very, very interesting active ingredients because we can use it only topical, without any needling, without any device, and it's going to be able to get inside the cell of our skin, inside the nucleus of our skin, and then change the transcription of genes that has been mutated because of like free radicals or any other action. So it is like an amazing, powerful biostimulator. And we know from PubMed studies that the best percentage of retinoids using to our skins is between 3 to 6. Because we are not getting a big risk of inflammation, but the efficacy is very, very good. So, when we are putting the product topical on the skin, we have inside the product, we have a molecules of retinol. As you can see here on this drawing, the retinol molecule are red circles. But to get this molecule inside our cells, inside the cells of our skin, we need to have 2 triggers. First one is the yellow one, which is called like a binding protein. So this is the protein that is going to be linked with retinol molecule. And they both together are something like a key to the door. Then the second trigger that is very important are receptors, the retinol receptors on the cell. Normally they are closed, but when they are going to see the key, which is a binding protein and retinol, they are going to get open and release the retinol molecule inside the cell. In that case, I am going to get this great result. Then we are going to achieve this metabolic pathway, and then at the end of this pathway, we are going to get the retinic acid that is going to get inside the human cells of the skin, nucleus of the human cells in the skin. This is this amazing action of retinoids, and this is the most important thing that we want to achieve. We are not expecting the big peeling effect. We are not expecting big inflammation. The most important for us is to get the retinol inside the cell and then to get retinic acid inside the nucleus of the human cell. Because here, like there, we are going to be able to change this transcription of mutated genes, and we are going to speed up the metabolism of the skin, and we are going to work with all the processes that have been blocked because of some triggers. So we could expect that if I am going to get higher percentage of retinol, I am going to get more of the molecule in the cell and then to the nucleus. It is not right, because we do not have a lot of binding proteins and receptors in our body. We are not going to increase the amount of binding proteins and receptors when we are going to put a higher percentage of retinol on the professional treatment. It is more like the same percentage is going to get to the cell, and the rest of the percentages of the molecules of retinol is going to stay superficial on the epidermis, and it's going to cause the inflammation. But we can do something to increase the amount of the binding proteins and receptors. We can cause something that we are calling a retinization process. So we are going to build more binding proteins and receptors by using the home care product with the lower percentage of retinol in the long term of time. So the RETIBOOSTER treatment is so unique because, first of all, we are going to have the treatment with retinol and the TGF-beta growth factor. And the second thing, which is very, very important, we are going to recommend, like in the protocol, to prepare the skin with our home care product, which is called retimodeling serum, with 0.3 retinol covered in liposome. So we know that it's going to get inside the skin and then release the retinol from the liposome, so it's much more safe also for sensitive skins. And then we are building the amount of binding proteins, of receptors in our skin, and the efficacy of the treatment is going to be much higher and the risk of inflammation much lower. So we're always recommending to use retimodeling serum before the first treatment and in the time, like in between the treatments that we are recommending to do in the session, the full session of RETIBOOSTER, which is like 3 treatments, 4 weeks in between. We have tested, as I said, we have tested our products with many different type of tests, like internal laboratories, external laboratories, with devices, application tests. Here, as you can see, it is instrumental test in a different skin types. So we can see that we can improve the smoothing of the skin by 17%, firming of the skin by 25%, and wrinkle reduction by 18% using our protocol. As you can see here, the photos of reduction of imperfections of the patient's skin. Here also the reduction of acne lesions. Here, the improvement of overall skin condition and anti-aging results. And here, reduction of hyperpigmentation and unifying the skin tone. We can see here the melasma on the forehead and removing this one after 3 sessions. Here as well, the reduction of hyperpigmentation. We have a very big amount of small dark spots on the skin on the left, and then the big change on the right side. As I said before, we are always trying to combine our therapies with different types of protocols, depending what type of the skin I would like to work with. And the treatment that we are working with RETIBOOSTER, we are calling RETIX.C concept, which is the different types of protocols depending what type of the skin I am going to work with. So as you can see here, we have a scale of 4 stages of RETIX.C concept. The first one is for vascular, sensitive and dry skins. And here we're going to put the product only topical. So first the ampule with antioxidants. We're going to spread the ampule after cleansing the skin, preparing the skin. We're going to spread the ampule all over the skin. And then we're going to put the vial with retinoids and the patient is leaving the clinic. The second stage for normal dry skins. As well, RETIBOOSTER is going to be used only topical, but before RETIBOOSTER, I'm going to use our Peptic Glow Peel, which is the one that is going to give us a great conditioning solutions on the epidermis. So it's going to prepare epidermis, and then we are working with the therapy of RETIBOOSTER. Then the third stage is for oily, mixed, normal skins, some scars and melasma. And here we are going to perform the first step with antioxidant ampule using microneedling with our Erpen device. And then right after the same session, we are going to put the product from the vial with retinoids on the skin, and the patient leaving the clinic and removing the product from the skin after several hours. And the last step of the RETIX.C concept, the fourth stage on the scale, is the full combination. So first we are performing the Peptic Glow Peel to condition the epidermis, and then we are using RETIBOOSTER with microneedling on the antioxidant ampule, the sterile ampule. When we are going to put the last step, so it is going to be the product from the vial, the reti-boosting complex. We know that retinoids, they are working in the long term of time, so to get the best results, the patient needs to leave the clinic with the product on the skin. As you can see here on this chart, we have different types of protocols on the RETIX.C scale and different types of the skin that we can expect in the clinic. And depending on those two triggers, we are going to recommend to leave the product on the skin for exact amount of hours. And this is something that specialists need to tell to the patient after how many hours they're supposed to remove the product from the skin. They're removing the product with the regular pure water. For all the stages of the RETIX.C concept, we have direct protocols. So this is something that I already mentioned before. The first stage, cleaning the skin, preparing the skin, then using the first step, second step, and then removing the product with the water. The second stage, the same, but before we are preparing the skin with Peptic Glow Peel. The third stage, I'm sorry, for the RETIX.C will be RETIBOOSTER by itself, but we are going to perform fractional microneedling on the ampule from the first step in the RETIBOOSTER box. Then we are putting the product from the vial and the patient leaving the clinic. And the fourth stage on the RETIX.C scale is going to be Peptic Glow as a first step. After neutralizing the peel, after 10 minutes, we are going to perform fractional microneedling on the ampule with antioxidants, with vitamin C, ferulic acid, niacinamide lactic acid. And right after, we are going to put the product from the vial with retinoids, and the patient is leaving the clinic. The fractional mesotherapy with our Erpen device is also something very unique that we can add to our treatments, that we can add to different types of the treatments that we have, but also, as we were mentioning before, we can add this treatment to our RETIBOOSTER bestseller treatment. A few information about our device and about the action that we can achieve. The device that we have is the one that we can perform the needling from 0 to 2 millimeters depth. We have 3 types of cartridges, which are 12 needles, 36 needles, and nano cartridges. Nano cartridges perfect for very, very reactive vascular skins. 12 needles for oily mixed skins, open pore skins, and 36 needles for more sensitive and dry skins. The type of the cartridge we are calling flower because the ending of the cartridge is a flower shape. So when we are performing the microneedling, the risk of the painful painful sensation is much lower than comparing to the regular devices. And what is very, very important with the fractional mesotherapy is the fact that we are using 2 important triggers. First of all, the physical, so the needles, when we are working with this type of mesotherapy, we're going to start the whole repair signal in our skin, and we're going to work to change the full quality of the skin because of the fact that we are working with this fractional physical trigger. And also, of course, pharmacological factor, because when we are going to work with the needling of the skin, we are going to spread the product deeper, and we are going also to work on the right contractions on the cells of our skin, so the potential of getting the product deeper to the skin is going to be much higher. Very important with our fractional microneedling is also the fact that we're always trying to combine all the therapies with this fractional microneedling and prove the efficacy using different types of studies. We are just ending the clinical case studies for RETIBOOSTER, combining with microneedling with a great results. As I said before about the device, it is very functional, very easy to use. We have 2 batteries. Each one is going to work 2 hours long. Also, we have a connector in the box, so I can charge the battery without using the AirPen device. So with one battery, I can still work in the clinic, and the other one is going to be charged separately without using our device. We are having the 7 different types of LED light that we are going to combine with microneedling. So I can work during the microneedling. I can switch on the LED light. Depending on the patient needs, I am going to use different type of the light. So we are having 2 different triggers that are going to give us the best results on the skin of our patients. Different types of the cartridges, as I had said before, the flower ending, and we are scrolling the cartridge to the device, so I'm 100% sure that the cartridge is not going to get out of the device during the time when I am working, performing the microneedling mesotherapy. Important factors that we are going to achieve working with fractional mesotherapy, just to make a summary. First of all, we are going to change the cell's membrane, the potential from 70 microwatts to 100 microwatts. As I said before, we are going to get this contraction. In that case, we are going to allow the release of proteins and potassium, and also growth factors. In that case, we are getting the signal to repair the skin and also to get the product deeper inside our dermis. Also, we are going to stimulate the intracellular matrix, and the migration of fibroblasts are going to get near the injured areas. We are going to stimulate fibroblasts, and we are going to get more fibroblasts, more collagen fibers, and we are going to promote the collagen and elastin to produce more of intracellular matrix to get the quality of the skin of the epidermis and dermis much higher. As you can see here, we are going to achieve this action. First of all, we are going to perform the injure in our skin, the growth factors, the fibroblasts, they are going to get there to calm down the skin after this injury. They are going to produce more collagen, type 4 and 7, but then it's going to change for collagen type 1 and 3. Then we are going to get this effect of increasing the quality of our skin that we are going to wait for. First step that we are going to get when we are going to see the microneedling, performing the microneedling on the skin of our patients, the first 3 days we are calling the inflammatory process, and in that time the skin might be sensitive, might be red. This is completely normal, and this is the time when we have the skin that needs to start to be repaired. The second step is proliferation, so we are starting to get more collagen to close the open channels on our skin that we have started to have because of the micro needling. And in that time, the fibroblasts stimulate the collagen type 1 and 3. And the first step is reconstruction, a very, very important step for us, because in that time it's 7 to 10 days more or less after the treatment. We are going to see the effect of our treatment. We are going to see that the quality of the skin has been increased, and it's going to become thicker. The structure looks much, much better, and it looks like it's regenerated. So this is something that we are like thinking only about the physical action, but as I said, RETIBOOSTER, we are having a great action of the product, and we can link the product with microneedling, mesotherapy, which is going to give us like a double effect from 2 sides, which is amazing, and we are seeing the results with very, very difficult problems with amazing effects, amazing results. Except of the fact what we need to be careful about after first 72 hours, which are like recommending to change a pillowcase, do not get close to the home animals, do not touch the face few first hours, do not put makeup 24 hours. Also alcohol and exercises 3 days after are not allowed, and getting tanned. And of course, we need to use photoprotection all the time that we are having the therapy, so free treatments that we are performing in the clinic. We have a lot of studies that we can find on a PubMed about the efficacy of the microneedling mesotherapy. One of them is like the treatment based on the patients with wrinkles and cigarette smokers that has used only microneedling mesotherapy without any product. It has been used to 1 millimeter depth, 6 treatments every 2 weeks, and they have achieved great results after the treatment of the microneedling mesotherapy without any product that we are recommending. Before the treatment, we are always recommending to do the interview with the client, inform about indications and contraindications, make the skin disinfection, which is obvious. What to avoid after, we already mentioned about that. So what to avoid after first 72 hours and what to avoid during the first week after the treatment. What are the most popular contraindications are the allergies on the active ingredients, skin allergies, pregnancy and lactation, the menstruation, then the bacterial infections, inflammatory conditions, tumors, patients with diabetes patients, using anticoagulants, and any herpes or relatives to the herpes. The risk of side effects is very, very low, but what we can expect is the pain during the procedure, which is normal because we are injecting the skin. Then the erythema or edema as a reaction on this physical treatment. The risk of hyperpigmentation because of post-inflammatory hyperpigmentation if the patient didn't pay the right exact attention to use the photoprotector right after the treatment. And important microneedling techniques that we are using with our device. Those two first we are calling the spiral and pass technique. So always we are moving the device. With the first one we are going to move like that, and the second one we are making the passes on the skin one way, like horizontal, vertical, or we can make something like a sun with the skin that are not so sensitive. And those two techniques are less painful, but we can use them until 1 millimeter depth when we are going to work on the skin. If we're going to make more than 1 millimeter, we cannot move the device working with microneedling because I can scratch the skin. If I am going to use more than 1 millimeters, I am going to use the stample technique. So I am going to put the device one step after another, one step after another. It is more painful for the patient, but we're not going to scratch the skin. So if we are having the procedure with more than 1 millimeter depth, we need to switch to the stample technique. Post-treatment recommendations with RETIBOOSTER. As I said before, we have the sample of the Ultra Repair cream for the patient to use it. They can use it right after removing the RETIBOOSTING complex if they feel the itching sensation, if they feel anything negative. But normally we're going to use it like 3 days after because the skin is going to peel a little at the time. We can also switch to Ultra Repair Nano Mask, which is a biocellulose medical mask, the puff mask, that we can cover the full area. Ferulic CCC serum, this is our antioxidant serum with 7 different types of antioxidants, and we can use it the second day of the treatment in the morning usage to reduce the oxidant stress. The retimodeling serum, we can use 2 weeks before the treatment, at least 2 weeks before the treatment, and we can use even 1 night before the treatment. But when we are going to make the professional treatment, and the next professional treatment is going to be after 4 weeks, the first week we are going to skip retimodeling serum, and the 3 more weeks we are using the retimodeling serum for the night usage again. And then the photoprotector SPF 50+, obligatory the whole session every morning, and it's supposed to be repeatable every 4 hours to get the best safety when it goes about the photoprotection. As you can see here, the competitive advantages, what we know, we have make a lot of studies, we have confirmed the safety and efficacy researches. We have clinical trials on the RETIBOOSTER with microneedling and without microneedling. It is a completely new generation of retinal therapies. It is like a patent pending because of the TGF-beta growth factor, maximum effect with minimum irritational potential, and our protocol with retinization process. It can be used for all skin types because of those 2 factors, like TGF-beta growth factor and our protocol. Unique treatments depending on the intensity that I want to work, like depending on the skin type that I'm working with, I can adjust the intensity of the treatment. And we are completing our therapy with the home care products to chase the results with a big satisfaction and great results. The last thing that I would like to mention here is the fact that our RETIX Brasia and our AUX antioxidant active ingredients that we have in our home care products and also in the therapy of RETIBOOSTER cannot be like compared one-to-one to the regular classical chemical pills. It is something completely different. It is not the pill, it is not a chemical pill, it is the multi-directional, multi-factor therapy that is going to give us maximum advantages with many different problems that we are having. For example, comparing peels with our RETIX brasia and antioxidant action, we are not going to expect the strong exfoliation. We are going to feel like a coconut shrimp exfoliation, like moderate chips exfoliation. The lipids, we are going to protect lipids in the epidermis, so we are going to protect the hydrolipid barrier of the epidermis of our skin. With chemical peels, we do not have any protection. The irritation is minimal in our therapy comparing to chemical peels. We are going to decrease the transfer of melanin to keratinocytes, so we are not going to expect the risk of hyperpigmentation. With chemical peels, there is always a risk of that. We are reducing the formation of melanocytes from the stem cells, so we are going to work to reduce the hyperpigmentation that already exists in the skin. Comparing to chemical peels, we have no effect on that. And the synthesis of the collagen and elastin is a really speeding up using our treatment, topical or performing the fractional microneedling, the fractional mesotherapy, because of vitamin C, TGF-beta growth factor, fluoretine, resveratrol, ferulic acid, vitamin E, and of course the physical stimulation of fractional mesotherapy. With classical chemical peels, we do not have this big effect on that. I hope this short video is going to explain much more about our bestseller treatment, how we can work with this treatment, how we can work with this therapy. It is not like a very simple peeling or like chemical peel therapy. This is multi-directional therapy that is going to help us to reduce hyperpigmentation, to work with acne patients, to work with post-acne scars, and of course to achieve amazing anti-aging results. We can adjust our protocols to different types of the skin depending with who I am working, and to get maximum effect without the risk of irritation, which is very important for us, because we know that we do not want to achieve the inflammaging, so the speed up of the aging of the skin because of the risk of inflammation that is running in our skin. Thank you very much for the attention, and for sure we are going to see each other on other videos that we are going to perform for us.